So if you're suffering from knee pain or knee arthritis, it's really important that you move properly to not irritate your knees. My name is Dr. Chad Kuntz. I'm a sports physical therapist, and I want to show you this one thing that you absolutely have to do correctly to make sure that your knee has the environment to heal. A lot of times people with knee pain are kind of just overusing their knees day after day after day. So I've got this chair here because we have to sit down every day. I don't care really who you are, at some point you have to sit down. And what's really important is that you squat down properly and you don't irritate your knees, you don't damage your cartilage by putting too much pressure through it. So let's go ahead and get into how you should properly be squatting if you have knee pain. Now if I'm going to go sit down at a restaurant, if I'm going to go sit down at the end of a long day, I should be able to get my butt back and slowly and softly sit down into that chair. And you're thinking, well, sure, you don't have knee pain. But it's still important that you sit down with your butt back, okay? So let me just show you it again. So if the chair's there, my first move is to get my butt back. Notice how my knees are barely bending at all, right? And I'm gonna continue that all the way up until the point that I can slowly sit down in there. Now, those with knee pain are doing this first. They're letting their knees bend, they're not getting their butt back, and then they just kind of plop down into it. So again, if I see people with knee pain, they come to me and I ask them to do this, this is how they do it. They're pretty much just plopping down. Now, it gets even more difficult if you don't have a chair, right? So if I ask you to squat in front of me and you have knee pain, this is what I see a lot of. I see a lot, almost their heels may come up, their knees come down, and they squat like this. Let me just tell you right now, if you squat like that, where your knees come that far forward, well past your toes, your heels come off the ground, no matter what surgery, medication, or therapy, or chiropractic services you're getting, the chances of you continuing to have knee pain are very high. Why? Because it's kind of like picking at a scab. You could have, a scar in there. You could have had surgery for that knee. But if you keep picking at that scab, it's not going to heal. It's not going to recover. So that's why this is so crazy important that we find the right level of squat that you can start practicing right now to think about, am I putting more pressure on my knees than I really need to in an everyday life? And that's really what it comes down to. So instead of this, what I want you guys to practice right now, and you can even hit pause after I show you, practice getting your butt back, letting the knees slightly bend, and being able to hold your position just like I am. I'd like for you to take a picture of yourself and compare it to what I look like right here. Because what I'm doing is getting my butt back. I'm using a lot more of my core. I'm using a lot more of my glutes. The glutes are the biggest muscle in the body, opposed to my knees. You can also use a wall if you'd like to practice this. So just for the sake of this, I found a wall. I'm going to reach back with my butt up until I find the wall, and there it is. I started about maybe 8 inches away. I'm reaching back, touching the wall, right? And I'm not using my knees here. I'm learning how to do what we call a hip hinge. I'm learning how to get my butt back to touch that. So then if I'm out and about and I have to sit down, it's that same motion. I'm getting my butt back. My knees aren't translating too far forwards, causing additional strain and additional pressure. So in conclusion, if you have knee pain or knee arthritis, it's so doggone important that you learn how to hip hinge and squat correctly. It's something that we have to do every day, no matter what. And if you've tried what you feel like is everything, you've seen chiropractors and physical therapists, I just tell you this right now, there's a lot of people that aren't correcting this, and it does take time. But if you're not correcting that squat, it's kind of like, I don't care what you do, that thing's gonna hurt you. Even if you have knee surgery, you'll still need to learn how to hip hinge and squat correctly. So I just wanna make sure that you guys know the importance of that. Feel free to go try it right now. I would say early on, try to do 20 hip hinge squats a day, where you're just tapping a wall, and I'm not saying going really low. All I'm saying is you're just practicing this, holding it for 5 to 10 seconds, standing up. Practice this, hold it for 5 to 10 seconds, and then stand up, to really teach your body how to do that. If you have any questions, feel free to reach out to us. I hope that helped. Thanks so much.